Yes.
Good evening, doctors. On behalf of FDC, myself Shailendra Meena hereby welcome you all on this first session of 52 weeks online module course on diabetes by none other than Padma Shri Dr. KK Agarwal sir. We wanted to have a comprehensive program on diabetes management in this changed scenario of COVID because we have seen that the most difficult patients to manage during and post COVID was patients with diabetes. This highlights the lacuna in our understanding of diabetes. So let's revisit our line of treatment and relook the way we treat diabetes under the able guidance of Dr. KK Agarwal sir. We have got more than 15,000, just to let you know, more than 15,000 doctors registered so far for this session. And I'm sure in next 2 weeks we'll cross 20,000 doctors. The way Dr. Agarwal sir takes the session, I'm sure we are going to get in-depth understanding of diabetes and overall its impact on all body parts and organs. And at the same time, we'll get many practical pearls for better management of diabetes. To begin with, today's session is on, we are starting from the basics, so classification of diabetes. And without taking much time, I'll hereby introduce Dr. KK Agarwal sir. Dr. KK Agarwal sir is recipient of 4 national awards, Padma Shri, Vishwa Hindi Samman, Dr. VC Roy National Award, and National Science Communication Award, and one state award for the Doctors and Philosopher of Indian Culture received from Delhi Hindi Sahitya Sammelan Sahit Shri Award in 2007. He has received he's a 3 Limca Book record holder in CPR 10, gold medalist, TEDx speaker, and recipients of Wiki Healthcare Personality of the Year Award in 2016. He is President, Confederation of Medical Association of Asia and Oceania, and President, Healthcare Foundation of India. He is Group Editor-in-Chief of IJCP, past National President and past Honorary Secretary General, Indian Medical Association. He is also past President of Delhi Medical Association and IMA New Delhi branch. He is former Ethics Committee member, Medical Council of India, and former Chairman Ethics Committee, Delhi Medical Council. So this is a brief introduction about Dr. Padma Shri Dr. KK Agarwal sir. Now I hand over the session to sir to take it forward.
Thank you,
Over to you,
Shailen.
sir. Thank you, sir.
Thank you, Shailen, for doing a nice introduction of the subject. Now, when we were doing our iron series, and we did it for 10 consecutive days, at that time we talk about F for iron, D for vitamin D, and C for vitamin C, which basically deals with FDC. So we said FDC is inseparable for COVID. And we talked about the drug Vitcofol in great detail at that particular moment. When we were dealing with the post-COVID state, one of the disease which was predominant was diabetes. We were saying first onset diabetes, first onset hyperglycemia, postprandial diabetes, diabetic sugar going up to 700. At that particular moment, every doctor said, let's revise diabetes. COVID was infecting the pancreas. And we felt need of not only managing diabetic well, but also managing that one should not have fluctuations in the blood sugar. So one of our aim was that when we give a hydration to a COVID patient, the blood sugar should not rise. We started looking at, so we spoke to FDC, and we came across Energal Zero, a rehydration drink with 5 vital electrolytes. So a drink for diabetics. So we said, we started looking for them. Why can't you come out with a complete 52 series on diabetes? They said, why? I said, F for fluid, D for diabetes, C for carbohydrate. In diabetic, take a fluid which is devoid of carbohydrate, which has 0 calories, which does not fluctuate the blood sugar. So this absolutely clicks to your company's name of FDC. So everybody will remember that in FDC means in diabetes, I need to take fluid devoid of carbohydrate. And then came the drug called Enerzal Zero. Their Enerzal is well known. They have added zero by saying zero carbohydrate. And that's with that, we thought, why not come out with a course of 52 sessions from very basics to very advanced. And all of you who have joined this course will be with us for 52 weeks. And I'm sure this will be a certified course. We will also be giving credit hours. The video will also be available on medtalks.in, where you can go back, see it again and again. We will end the session with a quiz. And anybody who answers the quiz, we will give them, they will get attractive prizes in the form of Energal Zero, which will be delivered to their house. So let's start with the first one, and that is, am I diabetic? Remember, diabetes is not a number. Diabetes does not mean 80, 120, 300, 400, 500. No. Diabetes is not a number. We have seen that if diabetes disappears, if the sugar disappears, the patient may be worse. The patient may have a kidney disease when the numbers goes down. We have also seen a number may be very high and a patient may not be diabetic. It may be a stress-induced hyperglycemia. So diabetes is not a number. And that's what COVID has taught us, that diabetes is a pro-inflammatory and a pro-thrombotic state. So let's look at, if a person has high blood sugar, what are the things he's going to look for? Only the number or something more than that? Let's have the slides, which I'm going to share. So this series will be called Diabetes Essentials 52 Weeks with Dr. KK Agarwal. So let's talk about diabetes as a classification. First of all, you ask your patient, does my patient have high blood sugar? Either yes or no. If you say yes, is it hyperglycemia? Is it a recent onset diabetes? Is it a reversible high sugar which is transient stress induced? Is it a metabolic syndrome? That means a patient has a cluster of findings. Is it pre-diabetes or diabetes? So once blood sugar is high, this patient may be simple hyperglycemia. It may be recent onset diabetes or first onset diabetes. It can be a reversible transient high blood sugar. It can be a metabolic syndrome, pre-diabetic or clinical diabetes. And when it comes to diabetes, we look for type 1, type 2, gestational and others. Most important thing we say is my patient pro-inflammatory and or pro-thrombotic or not? So when you have a patient with diabetes, suppose you have diabetes, you start looking for pro-inflammatory and pro-thrombotic, so which I will come back. So how do I know my patient is metabolic syndrome? He has 3 of the 5. His abdominal obesity more than 90 centimeter in men, more than 80 centimeter in women, or triglyceride more than 150 or on treatment, HDL less than 40 in men, less than 50 in women or on treatment, blood pressure more than 130 by 80 or on treatment, and fasting sugar more than 100 or drug treatment for elevated blood glucose. So out of these 5 parameters, if you have three parameters, the person is suffering from metabolic syndrome, insulin resistance, patient requires drugs as well as colchicine as a anti-inflammatory. Take it for granted, this metabolic syndrome is pro-inflammatory and pro-thrombotic. So if you have metabolic syndrome, you know he is pro-inflammatory and pro-thrombotic. Therefore, these are the patients will have high likely of getting COVID-19 reactions. Even after vaccination, they may show more reactogenicity and more production of CRP. Then is my patient a pre-diabetic? So remember, these two are different. In a pre-diabetic, the sugar will be between 100 and 125. See, in metabolic syndrome, more than 100. Here also more than 100, but less than 125. Therefore, pre-diabetic is a prerequisite for a metabolic syndrome. And the A1C will be 5.7 to 6.5. So some people say A1C of 6. So for the purpose of easy understanding, you can say 6. If your HbA1c is more than 6, pre-diabetic, more than 6.5 is diabetic. And once you have a diabetes, you start looking for type 1 or type 2 or hyperglycemia in pregnancy. Now, why it is important for me? Why it is important for me? It can be hyperglycemia in pregnancy, which can be gestational diabetes or diabetes in pregnancy. This is going to be a separate subject altogether when we discuss in the 52 series. But here it is important. Type 1 diabetes, early diagnosis. Type 2 diabetes, late diagnosis. Type 1 diabetes, I'm not worried so much about complications. But in type 2 diabetes, I know that by the time type 2 diagnosis is diagnosed, patient may already have complications. So therefore, it is important for me. A, he is diabetic. If he is diabetic, type 1 or type 2. Then we come back to the diagnosis of diabetes more than 6.5% HbA1c or 2-hour plasma glucose was more than 200 symptomatic. That's the way a standard definition. And we say fasting sugar more than 126 with no caloric intake for 8 hours. Hyperglycemia in pregnancy, we will talk in detail when we come back to a separate subject. And why measure C-peptide? Only if you are suspecting hyperinsulinemia, non-diabetic. This also we will talk later. Now, once we say diabetic, now I'm talking about diabetes. You say my patient is diabetic. First you ask controlled or uncontrolled. So you say 40-year-old male diabetic. Then we say controlled or uncontrolled. Controlled means A1C less than 7. In elderly, less than 8% in old patient. In pregnancy, less than 6%. In type 1, less than 6.5%. So you remember two things, 6, 7, 8. Pregnancy, less than 6. Normally, less than 7. Elderly, less than 8. Which coincides with the fasting sugar of 80 to 130. So this slide you can make, you can keep it. But the question today, because all these slides, every slide will be discussed in great detail in coming weeks. At this moment, so is my patient diabetic? You says no, then he is normal metabolic syndrome or pre-diabetic. And if you say, yes, my patient is diabetic, then immediately ask controlled or uncontrolled. If uncontrolled, management is different. Controlled diabetic, you say balle balle. So therefore, is my patient diabetic? Yes, controlled or uncontrolled. And we have already said pro-inflammatory or pro-thrombotic. So controlled can be pro-thrombotic or pro-thrombotic and pro-inflammatory. Uncontrolled can also be like that. And then comes says, are there complications present? So you say, my patient is 40-year-old male diabetic, pro-inflammatory status, pro-thrombotic status, uncomplicated or complicated. When you say complicated, you say the complications are present. Pro-inflammatory means CRP more than 1, which we will come later. Pro-thrombotic means D-dimer more than 500 and less than 1000. That's how we class them as pro-inflammatory and pro-thrombotic. Now you say my patient is, you say controlled or uncontrolled. And now you say it's complicated or uncomplicated. Complicated means macrovascular complicated. Does he have atherosclerosis, erectile dysfunctions, history of sudden cardiac death in the family, intima medial thickness, silent blockages in the heart, peripheral vascular disease, carotid enlargement, carotid blockages? Or is my patient having microvascular disease, retinopathy, nephropathy, neuropathy? Microvascular disease means endothelial dysfunction, would mean microalbumin will be present. So what do we say? Is my patient diabetic? Yes. Controlled, uncontrolled? You say is controlled or uncontrolled. Pro-inflammatory, pro-thrombotic, and now you say is complication present or not. Microvascular, microalbumin. Micro for micro. Remember the word. Microvascular means microalbumin. So if the patient has microalbumin positive, he has microvascular disease. And if his microalbumin is for microvascular, and for macrovascular, we look for intima media thickness. So how do we remember? M for myocardial, I for infarction. So myocardial infarction is called heart attack. Therefore, M for macrovascular, I for intima media thickness. So you say, are complications present? You say intima media thickness is normal. You say no macrovascular disease. You say microalbumin is negative, no microvascular disease. That's how we classify the diabetes. Then we say, if you say my sugar is controlled, when you say controlled or uncontrolled, you ask for, is it fasting which is controlled, or fasting and PP both are controlled, or PP is uncontrolled? Because now we know in COVID how important is postprandial uncontrolled diabetes. Then you say, these are a couple of things. When you diagnose a patient, you don't ask the patient, ask him, does he has erectile dysfunction or no? Make it as a part of the diagnosis. Write down in the full diagnosis, yes, with ED, without ED. And there are so many factors which we will talk as a separate subject. Then you say, is my patient having autonomic nervous system abnormality or not? Is there autonomic dysautonomia or not? If yes, is it peripheral? Is it cardiovascular? It is GI? Is it genitourinary? It is pupillary? Is it pseudomotor? Is it neuroendocrine system? And the easiest way to find out is resting tachycardia. Is my patient having a resting tachycardia and absent heart rate variability? You just do a simple Valsalva test and his heart rate will not vary. And the patient will say, if I walk for 1 minute, my tachycardia becomes very, very, very high. Very common autonomic dysfunction seen in COVID-19. And then we have all types of autonomic nervous system, which we will carry on in future. People forget about the family history. Ask your family history. Your parents had diabetes, brother has diabetes. Because diabetic, your job is not only to treat diabetes, but also to treat and prevent diabetes in the children, in the brothers, in the parents if they have. So your job is not only to treat. It's like COVID. Don't treat one patient, prevent COVID in others. Similarly, now we are talking about treat the patient and prevent diabetes or control diabetes in others. So what are the associated risk factors? Is it diabetes alone, or it is diabetes with hypertension, with obesity, with dyslipidemia, and with atherosclerotic cardiovascular disease? Obesity. Obesity and diabetes are together. Obesity means fatty liver, visceral obesity, abdominal circumference of more than 90 centimeter in men, 30 centimeter in women. Take it for granted that obesity and diabetes will be together. And you need to treat both of them. Remember, when you have CRP more than one, we say chini chawal maida personality or a ghee tel makhan personality. When you have obesity associated, you know this is chini chawal maida type of diabetes, which is called as a lifestyle diabetes. Alcohol, it has to come as a part of the diagnosis. Is he taking alcohol or not? Because we need to prevent sugar fluctuations. And remember, alcohol may worsen diabetic neuropathy. So alcohol may worsen diabetic neuropathy. And then hypertension. Is my patient hypertensive? Is my patient having controlled lipids or not? Is my patient a smoker? Smoking and diabetes cannot stay together. Chances of sudden death will be very, very high. And then apart from these, are there any comorbid conditions which are other than hypertension, obesity, and dyslipidemia, which can be hearing impairment, early cataract, sleep apnea, fatty liver disease, periodontal disease, cognitive impairment, depression, eating disorders, anxiety, fractures, and then certain cancers like liver, pancreas, endometrium, colon, rectum, breast, and bladder. These are the cancers which are common in diabetics. And then you say, what is the CRP level? More than 1 or less than 1? If the CRP is more than 1, less than 1, normal, between 1 and 3, mild inflammation, moderate inflammations, moderate silent inflammation, CRP 3 to 10, severe silent inflammation, and CRP more than 10 means obvious inflammation. So if the CRP is more than 1, take it for granted the patient is pro-inflammatory and pro-thrombotic. Means that you have no time for lifestyle. Inflammation has already started. LDL is going to become sticky. This patient is going to have complications soon. Myocardial infarction can occur, stroke can occur. So therefore, you can't manage sugar only. You can't say I'm only managing sugar. You have to manage so many other things in a diabetic patient. And then look for is he vaccinated or not. Normally patient aayega, he says, I've controlled your blood sugar, be happy. But he is not vaccinated for influenza, for pneumococcal, hepatitis B, tetanus, diphtheria, and herpes zoster. I need to be very clear. My diabetic patient should be controlled and given vaccinated. And now COVID-19 vaccine gets added into it. So flu, pneumococcal, COVID-19 vaccination, Hep B, tetanus, diphtheria vaccine, and herpes zoster vaccine should be given. So what is the final diagnosis? The final diagnosis is, you say, Mr. So-and-so, he is type 2 diabetic of so many years of duration. He is controlled or uncontrolled. Other associated risk factors, diabetes, hyperlipidemia, smoker, alcohol. You say associated macrovascular complications, you say IMT positive or negative. You say microvascular complications, microalbumin negative or positive. Then you say no other comorbidity. Then you say he is fully vaccinated or partially vaccinated. Then you say I've checked his autonomic neuropathy. He is no autonomic dysfunction or positive autonomic dysfunction. He has a normal or abnormal erectile dysfunction. He is in a pro-inflammatory or a pro-thrombotic state. And I've calculated his 10-year risk of heart attack, which is less than 10% or more than 10%. And I've calculated his risk of sudden death. And I've also told him the chances of transmission in the family. That's a classification of diabetes. When I say classification of diabetes, does not mean he's type 1 or type 2. That does not mean he is type 2 and you say blood sugar is, I've controlled his blood sugar. So you not only need to control his blood sugar, you need to control his blood sugar, other associated risk factors, associated macrovascular complications, microvascular complications, other comorbidity, fully vaccinated, taken care of autonomic neuropathy, with or without erectile dysfunction, pro-inflammatory versus pro-thrombotic state, 10 years risk of heart attack, risk of sudden death, chances of transmission in the family. This is a full diabetes consultation. And then I have not mentioned here diabetic depression. D for diabetes, D for depression. They are very highly, therefore I need to do the counseling. That's a full diabetic consultation. So diabetes is normally what you are supposed to do. If you have a diabetes, you can call him for 1 year and you say that today I'm going to talk about controlled versus uncontrolled. Next time I'm going to talk about microvascular complications. Third time I'm going to talk about vaccinations. So you educate him like in Bhagavad Gita, Krishna educated Arjuna for 18 times. You would educate him 14 times or 15 times, so he gives you 14, 15 extra consultations. Educate your patient. Tell them. COVID has taught us that patients is very, 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 very informative today. Sooner or later, he will come to know what to look for and what not to look for. We will come back to the question of the week. But before that, I want to see if there are any questions for that. If there are any questions in the audience, let me see. So there are, is vaccine safe for diabetic patients? Yes. Is ecosprin any contraindication before taking vaccine? No. We have already exposed to COVID. Is it necessary to take vaccine? No. How do I control my diabetes? We will take it up sooner or later. We will take it up in times to come. So we come back now to our question of the week. And the question of the week is, which statement best describes the difference between the characteristics type 1 and type 2 diabetes? Persons with type 2 diabetes usually require lower dose of insulin than persons with type 1 diabetes because they have milder form of disease. Persons with type 1 diabetes rapidly develop chronic complications. Autoimmune factors are involved in the pathogenesis of type 1, but not with type 2 diabetes. Persons with type 1 diabetes can increase endogenous insulin production by taking oral hypoglycemic agents. Kindly send your answer now, and we will announce the winner next week. So the whole purpose, I will invite Shailendra Meena ji back here. So the whole idea of this first session was to go beyond, to reclassify what do you mean by classification. Normally people understand classification means type 1, type 2, then Moody and this and that. But what I'm trying to say is classification is much beyond that. Classification is that is it controlled, uncontrolled, vaccinated, unvaccinated, heart failure, without heart failure, macrovascular complications or not. That full diagnosis need to be given on the patient for a consultation. If you are just telling him, I've checked your sugar, what is the difference between you and any other? Sugar can be controlled by anybody. Sugar is not the answer here. Sugar can fluctuate. And I'm going to end by saying again that do not allow your blood sugar to fluctuate. Control your carbohydrate intake. In one of the class, we will debate in great detail how to control your fluctuations, in sugar levels. And remember that if you are taking a fluid, we have energisol 0 by FDC, which talks about that you take a low carbohydrate or a zero carbohydrate fluid so that your sugar doesn't fluctuate. Over to Shailen.
Thank you, sir, very much, sir. That was a very wonderful session. As we have learned in our college time, the classification of diabetes, this was beyond that. So, as in the introduction, I said that we are going to get in-depth knowledge and also at the same time practical pulse from you, sir. So, you have very well justified the formula of 678, the metabolic syndrome, pre-diabetic condition, diabetic may be controlled, uncontrolled, vaccinated, so many things you have highlighted. So I am sure the audience would have got the uh, pace that we are going to run in next coming 51 weeks which are remaining. So that was a very in-depth session, sir. Thanks a lot for sharing your information, and thanks a lot all the audience and doctors who have attended, taken out time and attended. And I would like to thanks IJCP also for providing the technical uh, uh, solutions to that. Thank you, sir. Thanks a lot.
So that's all for today. We'll be back next week, 9 p.m. Keep watching 52 Weeks with Dr. KK Agarwal. Thank you very much. Stay tuned.